Run your tongue along the back of your bottom front teeth right now before you do anything else. Feel that rough, gritty ledge near the gum line? That little shelf that catches your tongue like fine sandpaper? Press a touch harder. You can feel exactly where the smooth part of the tooth ends and where something that feels almost like stone begins. Hold your tongue there for a second. That feeling is the whole video. Because most people past 60 have that ledge, and almost every one of them is about to spend the next 10 years fighting it the wrong way. They will scrub it, scrape it, whiten it, and lose. And they will never once understand why it keeps coming back. Here is the number that should stop you cold. According to the most recent national figures, more than 40% of American adults past the age of 30 live with some form of gum disease. Past 65, it climbs toward 2 and 3. And that hardened tartar your tongue just found is the quiet engine behind a huge share of it. You can feel it. You can see it in the mirror under harsh light. And you have almost certainly been treating it backwards for your entire adult life. I am not going to ask you to scrub harder tonight. I am going to ask you to scrub something completely different. Let me tell you what I think your evenings have looked like, and you tell me if I am wrong. You stand at the mirror. You tilt your chin up and pull your lip down, and you see it, the yellow, the tan. Sometimes the dark brown crust hugging the bottom edge of your teeth, thickest on the inside of the lower front ones, right where nobody else can see it, but you can feel it all day. And you have tried things. Be honest with yourself. The little metal pick from the drugstore, the charcoal powder a video swore would melt it away, the baking soda paste a neighbor promised buy. Maybe whitening strips, maybe a stiff brush, and a lot of frustrated pressure. And for about 2 weeks, it looks a little better. You feel a little hopeful. Then it comes back, same spot, same ledge, same color, as if you never touched it. So somewhere along the way, you made a quiet peace with it. You told yourself it is just age now, just what teeth do after 60, just one more thing the years take. It is not age, and it is not a lack of effort. You have simply been aiming at the wrong target this whole time. Here is the belief almost everyone holds, and it is the exact reason the tartar always wins. People believe the tartar is the problem. They believe that if they could just scrape it off, scrub a little harder, find the right powder, the right oil, the right gadget, the problem would finally be solved. So they attack the crust. Night after night, with more pressure, more grit, more hope, and they lose every single time. Because the crust is not the problem. The crust is the receipt. It is the proof that something else happened 3 days earlier, somewhere you weren't looking. You are standing at the sink, scrubbing the receipt and wondering why the bill keeps arriving. Let me show you what is really happening. And I'm going to use something sitting in your own kitchen to do it, because once you see this, you will not be able to unsee it. Picture the inside of an old electric kettle, the kind that has boiled water every morning for years. Look down into it and you see that chalky, crusty white coating clinging to the metal. That is limescale. It comes from the minerals dissolved in hard water. Every single time you boil that kettle and let the water sit, a microscopically thin layer of mineral drops out of the water and grips onto the rough surface inside. Now here is the part that matters. You can take a scrubber and attack that spout all you like, but as long as you keep filling the kettle with hard water and letting it sit, the scale comes back. Scrubbing the crust does absolutely nothing to the water that makes the crust. The crust is just the water's leftovers. Your mouth works in exactly the same way. The tartar on your teeth is the limescale. Your saliva is the hard water, and your saliva is loaded with minerals. And the soft, invisible film that builds on your teeth every day is the rough surface those minerals grip onto. So look at what you have been doing all these years. You have been scrubbing the inside of the kettle. You have never once thought about the water. If this is the kind of plain, unhurried explanation your last dental visit was too rushed to give you, subscribe. I take it one careful mechanism at a time, and the next few build right on this one. Now, before we go a single step further, I need you to hear something clearly. This matters more than anything else I will say tonight. If your gums bleed every time you brush, not once, but again and again, If you have noticed your gums pulling back and your teeth starting to look longer than they used to, if a tooth feels even slightly loose when you press it with your tongue, if there is a bad taste or a smell that keeps returning no matter what you do, or if there is a sore anywhere in your mouth that has not healed in 2 weeks, do not wait this out. See a dentist. Those are not tartar nuisances. They can be signs of advanced gum disease or of something that needs a trained eye, and nothing in your bathroom cabinet replaces that appointment. And here is the honest part, the part the internet keeps from you, because it does not sell anything. The hardened tartar that is already cemented onto your teeth right now, the rock-hard ledge your tongue found at the start of this video, does not come off at home. It cannot. No powder, no oil, no rinse, no brush, and no 14-day miracle removes hardened tartar. Once that film mineralizes, it bonds to the tooth like cement to brick, and only a dentist or a hygienist can take it off, with instruments built for that one purpose. So when someone online promises that hardened tartar will simply lift off at your sink in 2 weeks, you now know exactly what is true and what is a sales pitch. What you cannot do is dissolve the stone that is already there. What you absolutely can do, and this is the entire point of tonight, is stop making new tartar and lift the soft film every night before it ever gets the chance to turn to stone. That is the part you control completely. And that, not the scrubbing, is where the real win has been hiding the whole time. So let us go to the water. Let us understand, step by step, how the limescale actually forms. Because the moment you understand it, the nightly habit becomes obvious and even simple. Start here. The second you finish brushing, your teeth do not stay bare. Within seconds, a paper-thin layer of proteins from your saliva settles down over the clean enamel. Dentists call it the pellicle. Think of it as a primer coat, the undercoat that paint grips onto. It is harmless by itself, but it is the surface everything else builds on. Then the bacteria arrive and stick to that primer. And as they multiply, they form what you can actually feel by the end of the day, that fuzzy coating on your teeth. It has a name. It is called plaque, and plaque is a biofilm, a living, organized colony of bacteria. The Cleveland Clinic describes it in a way I have always loved. Run your tongue across your teeth, and if they feel like they are wearing tiny sweaters, that fuzz is the plaque. It begins reforming within minutes of cleaning. You cannot stop it from appearing. Everyone has it. That part is normal. Inside that film lives the crew. And one bacterium in particular runs the whole operation. It is called Streptococcus mutans, the main microbe behind cavities. Here is what it does, and it is genuinely clever. When you eat sugar, and especially when you eat sugar and starch together, this microbe takes that sugar and spins it into a sticky substance called glucan. Glucan is a kind of biological cement. It is the glue that lets the bacteria lock themselves onto the tooth and onto each other, building the thin film into a thick, layered fortress that your own saliva and immune defenses struggle to break through. And while it builds its glue house, it pours out acid. That acid sits trapped against your enamel, the hard outer shell of the tooth, and slowly pulls minerals out of it. The dental term for that is demineralization. There is even a tipping point dentists track, a level of acidity called the critical pH, below which the enamel starts dissolving and above which your saliva can rebuild it. Every time you eat or sip something sweet, you drive your mouth below that line, and your enamel takes a small hit until your saliva can buffer it back. That is how a cavity quietly begins, long before you ever feel a thing. But here is the part nobody explains to you, and it is the whole secret of this video. That soft film does not stay soft. Leave it sitting undisturbed, and within roughly 24 to 72 hours, just 1 to 3 days, it begins to harden. Why? Because your saliva is rich in minerals. It is full of calcium and phosphate, and it bathes your teeth all day and all night. When the film sits in one spot long enough, those minerals precipitate out of the saliva and drop straight into the film, exactly like the limescale dropping out of the hard water in your kettle. The film hardens into calcium phosphate. It mineralizes. And now it has a brand new name, tartar. or in your dentist's chart, dental calculus. That is your limescale forming. Right on schedule, every 2 to 3 days, in the exact spots your brush keeps missing. And it forms in two places. There is the tartar above the gum line, the yellow and tan ledge you can see and feel. And there is a darker, more stubborn kind that forms below the gum line, hidden in the little pocket between gum and tooth. That hidden kind is the one most tied to gum disease, and it is the one you will never reach yourself. That below the gum tartar is precisely why the professional cleaning is not optional. It is the part of the kettle you simply cannot see down into. So look honestly at what you have really been doing all this time. You wait for the film to turn to stone. Then you spend weeks attacking the stone with abrasives and metal picks, doing nothing but scratching your enamel and tearing at your gums. The stone does not care. It is bonded on. And while you fight the old crust, fresh film is already mineralizing again on its quiet 1 to 3 day clock in the corners you never reach. So here is the myth, said plainly. The myth is that harder scrubbing removes tartar. The reality is that harder scrubbing damages your enamel and your gums and does almost nothing to the cement that is already set. The real target was never the rock. The real target is the window, that 1 to 3 day window before the soft film becomes stone and the specific spots where your saliva runs hardest. Hit that window in those spots every single night, and the limescale simply stops forming. You never have to dissolve a stone you can never dissolve. You only have to stop letting it harden in the first place. That is the whole game, and almost no one is playing it. Let me give you a few simple checks you can do tonight so you can see your own personal pattern. First, the tongue test you already did. Run your tongue along the inside of your lower front teeth. That is the #1 spot tartar forms, and there is a real reason for it. 2 saliva glands sit right under your tongue and spray mineral-rich saliva onto that exact surface all day long. It is the hardest water corner of your entire mouth. No wonder the limescale collects there first. Second, run your tongue and your cheek along the outside of your upper back teeth, up near where the cheek meets the gum. There is another large saliva gland right there, draining onto that surface. If you feel roughness in those two zones especially, you have just mapped where your personal limescale builds, and it is not random, it is plumbing. Third, in the mirror, in good light, look right at the gum line. Is the buildup sitting where tooth meets gum, like a tide line on a beach after the water pulls back? That tide line is where the film sits longest undisturbed and where the minerals drop heaviest. It tells you exactly where your brush has been skipping. Fourth, gently. When you brush tonight, notice whether your gums bleed. A little bleeding is your body telling you the film at the gum line has been sitting too long and the gum has grown inflamed. It is not a reason to brush less. It is a reason to clean that exact line more gently and more often. If the bleeding is heavy or it never settles down, that goes straight back to what I said earlier. See a dentist. And a fifth, quiet one. Notice your breath honestly in the morning before you do anything. Persistent morning breath, even when you brush well, often traces back to the same bacteria sitting undisturbed overnight in the film. It is a clue, not a verdict. Now let us deal with the water itself, because what you put in your mouth decides how fast the film builds and how aggressive the acid gets. The single worst combination for your teeth is not sugar by itself. It is sugar plus starch. Think of a sweet pastry, a cookie, crackers with jam, soft bread with honey. That pairing hands the microbe its favorite fuel and helps it spin extra glue that clings far harder than sugar alone ever could. The starch packs into the grooves, the bacteria feast, and the acid pours out for far longer than the snack lasted. And here is a habit that quietly does more harm than any single food: sipping. If you nurse a sweet coffee, a soda, or even fruit juice slowly across the whole morning, you are not having one acid attack. You are having a dozen small ones, back to back, never once giving your mouth the chance to recover and rebuild. Strange as it sounds, your teeth would honestly rather you drink it quickly and be done than sip it for 2 hours. There is one more thing that turns your saliva into harder water, and almost nobody connects it: dry mouth. Many of the most common medications after 60 for blood pressure, for mood, for allergies, for sleep reduce how much saliva you make. Less saliva means the film is not rinsed away, the acid is not buffered back, and the saliva that remains is more concentrated. And tobacco does the same thing, while feeding the buildup directly. So if your mouth runs dry, take it as a signal. Your limescale is forming faster than it should. So what protects you? Water, first and simplest. A plain glass of water after you eat rinses away loose sugar and starch and gives your mouth a chance to climb back above that critical line. Foods you actually have to chew: crisp vegetables. An apple, a small handful of nuts do double duty because the chewing itself triggers a flood of saliva that washes and rebalances the whole mouth. And cheese, of all things, has a quiet, well-earned reputation in the research for helping nudge the mouth back toward a less acidic state after a meal. You have probably heard a great deal lately about vitamin K2 and the teeth, so let me be careful and honest with you about it. There is real developing science here. Vitamin K2 appears to help your body steer calcium where it belongs, into bone and teeth, rather than letting it settle where it should not. You find it in foods like certain aged cheeses, egg yolks, and fermented foods, and including those in a balanced diet is reasonable and may support your tooth and bone mineral health over the long run. But hear me clearly, because this is where people get sold a fantasy. No food on this earth dissolves the tartar already on your teeth. K2 is a long, slow support for the structure underneath the enamel. It is not a scrubber, and it is not a cure. Do not let anyone hand it to you as one. Now you understand the mechanism, and only now does the habit make real sense. So here is the nightly sequence. Do it in this order, because the order is half the trick. Start with the spaces between your teeth before you brush. Floss or use a small interdental brush or a water flosser if your hands prefer it. Do this first because the film hides between the teeth and right at the gum line, exactly where toothbrush bristles cannot reach and exactly where tartar loves to begin. You are breaking up the film in the hardest water corners before you do anything else. Then brush. 2 full minutes. Not the 45 seconds most people actually do when they are tired. Set a timer once and you will be shocked how long 2 minutes really is. Use a soft bristled brush. Soft. Not medium, not hard. If you use an electric brush, even better, but let it do the work and do not press down. Angle the bristles at about 45 degrees toward the gum line, so you are cleaning that tide line where tooth meets gum, not just polishing the flat faces of the teeth. Small, gentle circles. You are not sanding wood, you are sweeping a thin film off a surface. And replace the brush or the brush head about every 3 months because frayed bristles clean the tide line poorly. About your toothpaste, you have 2 strong, evidence-based choices, and you can even alternate them. A toothpaste built around baking soda is a quietly excellent option. The research, including a review published in the Journal of the American Dental Association in 2017, and a systematic review a couple of years after, found that baking soda toothpaste remove plaque well, reach the less accessible surfaces, calm gum inflammation, and lift surface stain. And they do it while staying gentle on the enamel because baking soda is a low abrasion polish, not a harsh grit. Your other strong option is a toothpaste containing hydroxyapatite, which is the very same mineral your enamel is built from. The clinical evidence shows it can help remineralize the early, soft, demineralized spots and reduce sensitivity. One cleans and balances the acid, the other rebuilds and protects. Both work with your mouth instead of fighting it. And if your dentist agrees it suits you, a tartar-controlled toothpaste, the kind with ingredients that chemically slow new mineral buildup above the gum line, can be a sensible third tool in the rotation. Here is a small step almost everyone gets wrong, and it quietly costs them the whole benefit. After you brush at night, do not rinse your mouth out with a big swish of water. Just spit out the excess and stop. Leave that thin film of toothpaste on your teeth overnight. That is when the minerals and the protective ingredients get hours to do their slow, quiet work undisturbed while you sleep. Rinsing it all away the instant you finish washes the medicine straight down the drain. If your mouth runs dry, address it head on. Keep water by the bed. Consider a xylitol lozenge or gum, which the bacteria cannot turn into acid. And try to breathe through your nose, not your mouth, while you sleep, because mouth breathing dries everything out and speeds the entire process up. And then the one piece that ties the whole thing together, get the hardened tartar that is already there removed once by a dentist or hygienist, including that hidden kind below the gum line that you will never reach. Think of it as descaling the kettle. They reset the surface back to smooth. And then your nightly habit, the flossing, the gentle gumline brushing, the leave it on toothpaste, the glass of water after meals, keeps fresh limescale from ever forming again. The professional cleaning is the reset. Your nightly routine is what makes that reset last for months instead of weeks. That partnership is the thing that actually works. And it is the one almost no one explains to you because there is no money in 2 boring minutes that prevent the problem. The money is all in what comes after. So what can you honestly expect after 14 nights of doing this? Let me be straight with you, because you deserve that. You will not watch a hardened ledge fall off into the sink. Anyone who promises that picture is selling you something. The stone that is already set needs the dentist, full stop. But within about 2 weeks, real things change, and you will feel them with your own tongue. The new film no longer gets the chance to harden because you are disrupting it every night inside that 1 to 3 day window. Your gums, no longer sitting under a layer of irritating film while you sleep, begin to calm down. Less puffiness, less of that bleeding when you brush. Your teeth feel noticeably smoother to your tongue. Surface stain lifts and the color brightens a shade. Your breath improves because you have starved the bacteria that make the smell. And most important of all, you have stopped feeding the next layer of stone before it could ever form. That is the honest 14-day result. Cleaner, smoother, calmer. And for the first time in years, moving in the right direction instead of losing the same quiet fight over and over at the same bathroom mirror. So here is exactly what to do tonight. Simply, 1. Drink a full glass of plain water after your last meal or snack. 2. Floss or use an interdental brush before you brush, hitting between the teeth and right along the gum line. 3. Brush gently for 2 full minutes with a soft brush angled at the gum using a baking soda or hydroxyapatite toothpaste. 4. Spit, do not rinse, and let that thin layer sit overnight. 5. If your mouth runs dry, set water by the bed and breathe through your nose. 5 steps, 2 minutes of real work. That is the entire engine, and it is the engine that finally runs in your favor. And do something for me before you go. Tell me your decade in the comments. Are you in your 60s, your 70s, your 80s? I am asking for a real reason. After 70, dry mouth and the side effects of common medications start to change. Which part of this matters most for you? And I shape the next video around the people who are actually here watching. So drop your decade below. It tells me exactly who I am writing for. So the next time you stand at that mirror and your tongue finds that rough little ledge, I want you to remember the kettle. Stop scrubbing the crust. The crust is only the receipt. Go after the water and the film instead, every night, in the corners where your saliva runs hardest and the limescale simply stops forming. You were never failing at this. You were only aiming at the wrong target. And now you are not. Good night. Be gentle with your teeth.